Good evening, everybody. In this era of COVID, we're going to start by practically washing your hands thoroughly. Thank you so much. I'm going to discuss two issues with you. I'm Dr. Gwatidzo. I promised people in our group that I'm hoping that by the end of today, I'll be able to shoot a small video to demonstrate two issues of concern. First of all, as you can see, I've got my vial there, which has got onion, and I think these are small ones, so I'm going to take two of them. Because of quercetin, normally we don't remove the outer coverings, which are golden. So I'm going to cut them into 1 cup, and normally we'll take this one in the evening because onion puts you to sleep. You don't want so much of it during the day, or for a child or someone who's going to an examination. So I've taken this one like 1 big onion, and then I'm going to take a bulb of garlic, and I've taken about 2 cloves. I don't remove anything also, just cut it from the bulb. You get cloves, and I'm cutting the cloves as small as I can, though I'm not doing it as thoroughly as I would do. This is a demonstration. And then I already have my boiling hot water. I pour it into the cup. And this is my tea for this evening. Normally you'll take this tea after a meal. But if someone has an attack of influenza, and in particular we're talking about an influenza A variant, you want to be sure that they get the treatment as early as possible. Normally they've got a lot of mucus within their stomach. They can take the first cup directly like that. Usually, after taking this cup, the following day they are much better. But we cannot predict what might actually happen with this particular strain of COVID-19. Otherwise, all these treatments I'm discussing, they are at household level. So you just let that stand and let it go. Now I'll go on to the next. Before I finish, on this particular one, you want to squeeze in half a lemon. I've put a bit too much here. You want to squeeze in half a lemon into that particular cup. And you just let it stand. You don't need to steep or to cover it. Just let it cool like that. Then people are talking about steam therapy, steam inhalational therapy. I went through a lot of that because I was an epileptic during trials of therapy, and people would cover themselves within a blanket. But usually you don't need to do that. Here I've got our guava leaf. You put it in the vessel in which you are going to boil. You want a vessel which is in that, if it's an enameled pot. But as you shall see, the best pot, then that's the lemon I've just put in there. The best pot is actually the clay pot. That's the best pot in the world. And they've got our zumbani. We are living rural, so we've got everything either within the garden or just outside. Then we have got our mango leaf. And all this has been washed. Remember, we live with the organisms, and we don't want eggs of other organisms or eating things to be, or droppings to be on the leaf. So you want to make sure everything is washed. If you are going to have a steam inhalational therapy for viral upper respiratory tract infections or to prevent, you want to be sure that there is always eucalyptus. Someone who already have got running nostrils, you find that if you are going to have steam inhalational therapy and you don't have the eucalyptus there, your treatment is actually half done, because eucalyptus alone can dry the sinuses. The following day you will not have any running nose. And for this amount, maybe for 2 people, I put here 1 liter of water, and I put this over the fire. So I will hand this to someone else. And assuming that this has been brought to boil for about 15 minutes, they're actually bringing over now the pot, because they've got another one actually ready. Can you bring it for me? And always be careful about safety. You just put it here for me. Make sure everything you use for cutting is clean. Everything is washed. If you've got your soccer tool, make sure everything is actually washed. So as you can see, this is actually steam hot. So I'm going to make sure I take this. I pour. James, where are you? I pour for James, I pour for myself. Okay. Suppose James is having running nose, which is, there's a problem also with the breathing. The breathing is a serious matter. You can take yours. So we actually hold this at chest level and we begin to breathe. In, out, in, out. This is enough. And then people ask, for how long are you going to breathe? I always say, until there is no more steam. So all this is adequate. You don't need to really cover yourself. If it is a child, you can actually put this on the table and you can hold the baby or the child over the cup. Just make sure they are safe and they breathe. You can actually change. You can keep this pot on the fire if you want to extend it a bit, and you can always get it again and refill the cup once there is no steam. But usually one session until there is no more steam is usually enough to do the trick. And the following day, if you have included eucalyptus, you will find that there is no more running nose at all. The sinuses are clear, the airways are clear, the breathing is much improved. Combined with the onion and garlic, you find that you will be done. Now the zombani usually it takes away sleep, so you don't want usually to do it in the evening. So you want to remove it in the evening if you are going to drink half the cup at the end of it. Because usually for an adult they may actually drink a full cup, or you can drink half the cup or a quarter cup for very small children. But usually this doesn't do any harm. You only have to make sure that your gum tree leaves, they are coming from a tree which has been planted in these seasons, not in the past, because in the past they used to use a chemical which was very lethal. So you want to be sure that you are safe wherever you are getting your branches of gum trees from. Otherwise, any questions I'll entertain as we chat on the group. Thank you very much.